Hi there. Welcome back to my new segment of Dynamics in Healing entitled News and Views on Mental Health from across Canada and worldwide. Let's get started on the most recent news. After Afghanistan retreat, U.S. veterans face difficult 9/11 anniversary. 20 years after the September 11th attacks, many veterans of the War on Terror are feeling a renewed sense of grief and anger. The hasty U.S. withdrawal from Afghanistan and the return of the country to Taliban control have exacerbated the trauma they feel on the anniversary of the assault on the American homeland. People are feeling it acutely right now, says Dr. Shelley Amen, a psychiatrist who works with veterans. They're feeling a deep sense of betrayal in a lot of ways. The Veterans Crisis Line, run by the U.S. Department of Veterans Affairs, began reporting a sharp uptick in calls and texts after the fall of Afghanistan. As September 11th drew closer, many veterans said that an already difficult date on the calendar had been made worse by renewed questions about whether the war in Afghanistan was even worth it. They are literally haunted by the uncertainty of what comes without a U.S. presence in the country. The truth is, I can't get around the fact that I absolutely believe that something bad is going to come back out of that country in the next 7 to 10 years, says Tom Amenta, a U.S. Army veteran who served 2 tours in Afghanistan. When soldiers like Amenta first deployed, their mission was explicitly clear. We had a high-value target list of people that were directly responsible, he says. We were going to find them and we were going to either capture or kill them. That was it. After Osama bin Laden was found and killed by U.S. forces in Pakistan in 2011, the U.S. stayed in the country and attempted nation building. Amenta argues the fundamental counterterrorism mission was still successful. The reality is that what we were tasked to do, we did excellently. They have the honor of their service, and that no one can take that away from them, she said. Dr. Amen said she had spoken to several people who were seeing symptoms of post-traumatic stress disorder flare up ahead of the 9/11 anniversary. She implored veterans to approach the date with an action plan for their own mental health and well-being. Have something set on your calendar. Maybe have a couple of phone numbers in your pocket of people that you can call, she suggested. Healing is possible. Despite his concern about Afghanistan becoming a future breeding ground for terrorism, Tom Amenta has found comfort by focusing on the success of the U.S.-led mission and his own personal service. He recently co-authored The 20-Year War, interviewing fellow veterans from the War on Terror to document their stories. We kept the world safe, he said. Not just Americans, but Canadians, the Aussies, everyone in NATO, everybody who stepped into that country and said 9/11 will not happen again. Sick Kids receives $50 million donation for brain and mental health initiatives. The Foundation for the Toronto Hospital for Sick Children says a $50 million donation will further research and treatment in the field of pediatric brain and mental health. The Sick Kids Foundation says the gift from Toronto entrepreneur Gary Hurwitz will support the hospital's centers for brain and mental health and community mental health. The not-for-profit says the funds will also support Sick Kids research, care and education to improve outcomes for children and youth affected by neurological and mental health conditions. The donation will also allow the hospital to hire a dedicated director of the rebranded Gary Hurwitz Center for Brain and Mental Health. The foundation says the money will also help support new therapies for neuromuscular, neuroinflammatory, and neurodevelopmental diseases. Treatment models for youth and families affected by complex mental health issues, and an innovation fund to aid investments in cutting-edge research. It says the donation is all the more impactful in light of Sick Kids research on how the COVID-19 pandemic has taken a toll on youth mental health. The U.S. Senate will grill tech execs after report that Instagram can harm teens' mental health. A U.S. Senate panel plans to bring tech executives back to Capitol Hill following a revealing report from the Wall Street Journal about the impact of Facebook's Instagram platform on teens' mental health. Senator Marsha Blackburn, Republican for Tennessee and ranking member of the Senate Commerce Subcommittee on Consumer Protection, announced the hearing in an interview on CNBC's Closing Bell. Blackburn said the hearing would take place in a couple of weeks and would include representatives from Facebook, TikTok, Twitter, Snap, and Google-owned YouTube. A spokesperson for Blackburn said a hearing date and the specific attendees from the companies have not yet been confirmed. The Journal's report, which the outlet said was based on internal documents from Facebook, revealed that the company had been aware of significant negative impacts of its photo-sharing Instagram app on teenage girls. At a March hearing, CEO Mark Zuckerberg testified in response to a question about children and mental health that research he's seen shows that using social apps to connect with other people can have positive mental health benefits. What we know is a lot of this anecdotal information that we had from parents, teachers, pediatricians about the harms of social media to children, that Facebook was aware of this, Blackburn said. Although both the House and the Senate have hauled tech CEOs to Congress several times over the past couple of years, Blackburn said she expects this hearing to stand out because of its bipartisan. We are determined to do something in a bipartisan way that is going to protect our children in the virtual space, that will allow them to be able to use the internet, to do Zoom school if they need to do research, but to be protected and to have their privacy protected when they are online, Blackburn said. We're exploring ways to prompt users to look at different topics if they're repeatedly looking at this type of content, Karina Newton, Instagram's head of public policy, wrote in the blog post. We're cautiously optimistic that these nudges will help point people towards content that inspires and uplifts them, and to a larger extent will shift the part of Instagram's culture that focuses on how people look. Indigenous youth in New Brunswick need more mental health support. A report on youth suicide prevention in New Brunswick, Indigenous communities, is calling for provincial legislation that would recognize and support Indigenous languages and for mental health funding. The report released last Tuesday, called No Child Left Behind, makes 13 recommendations or calls to action to address the challenges faced by Indigenous children and youth. First Nations Advisory Council co-chair Roxanne Sapier says there have been 8 suicides of young Indigenous people in the province since the council began working on the report in April. She said while the national suicide rate among Indigenous people is 3 times higher than among non-Indigenous people, it is almost 7 times higher in Indigenous males between the age of 15 and 24. The mental health and wellness issues that First Nations deal with are unique, she told a news conference on the St. Mary's First Nation in Fredericton. Our identities and cultures have been disrupted by a long colonial history and its many impacts, including intergenerational trauma, as a result of residential schools, erosion of our languages, cultures, and spirituality, she said. Research has shown that Indigenous youth who know their languages and cultures are more resilient and are at less risk of suicide. Connection to language and culture is also essential to treating and preventing trauma and addiction, she said. Chief Aaron Stock of Elsipogtog said he recently looked at a picture of his grade 5 class, and 8 of the 15 children, 5 of the boys and 3 of the girls, had died by suicide. Once again, if at any time there was a particular piece of news covered that you would like to comment on, feel free to do so on my channel. And if you're new to the channel, please make sure to subscribe. Until next time, take care, and thanks for watching the latest news and views on mental health.